Hello, I am Dr. Harpreet Lotay, and these are the top 4 recommended ingredients that I believe should be in everyone's daily skincare regime. Let's begin with talking about what happens to our skin as we age. There are several things that happen, and when you look at it under the microscope, you can tell that older skin is very different from younger skin. The younger skin is a lot more robust, there is more structure to it. The older skin has a lot more space, and the epidermis is a lot thinner. There are a lot more dead cells in proportion to living cells. The collagen decreases, and the cells called fibroblasts diminish. Science is really discovering how important these fibroblast cells are. The enzymes, peptides, growth factors, and cell signaling molecules that they make help us grow more collagen. What causes skin aging in the first place? There are lots of things that make our skin age. They can be intrinsic factors like our genes and how we are programmed to age. Inflammation is a big factor in skin aging, and that can be influenced by lifestyle factors such as how we eat, how we sleep, and how we manage our stress. Any disease or pathology that we may have can also contribute. Any medications that we take or drugs that our bodies are exposed to can also affect how our skin ages. One of the biggest factors is actually UV radiation from the sun. 90% of premature aging is caused by UV radiation. It causes inflammation, it makes your skin hyperpigment or hypopigment, and it also breaks down collagen. If I'm going to be spending my money anywhere, it's going to be on sunscreen. This is why you're always hearing us at the clinic ask everyone, do you wear sunscreen? Some answers are that people wear it only during the summer, but I let them know that I wear it every single day of the year, even in the winter. The other questions asked are with regard to the SPF number. Should I wear SPF 15, 20, 25, 30? That is a complicated thing, and most people assume that if you go to a higher SPF numbered sunscreen, you're going to get significantly or exponentially more protection. But that's not quite true. It's not a linear graph for protection. Once you get above SPF 25, you're protecting yourself from over 96% of the rates. You don't need to spend a heck of a lot more on the SPF factor, but what you want to focus on is the tolerability of the product. Do you like it? Are you going to wear it? And how long does it last? If you're wearing a sunscreen that lasts for an hour and you're having to put it on again every hour, it's not going to do you much good because you're unlikely to reapply as often as you should. The other thing that people ask me about is ingredients. I usually break sunscreens down into 2 camps. One are the physical sunscreens, which are made up of micronized metal that you apply to the skin. What happens is that you reflect the sun off of your face. You are protecting yourself from a wide spectrum of radiation. It's bouncing off. Chemical sunscreens absorb the energy from the sun. The chemicals will take the radiation, catch it, and convert it into heat energy in your skin. The rays will change formation of the chemicals and release the heat energy, thus absorbing radiation energy. This is not very helpful for some people who have rosacea, and some people may find that their skin is sensitive to the chemicals. My personal preference is physical sunscreens, and I like to layer sunscreen as well. Layering is helpful because I might miss some spots or spread an area too thin so that the micronized pieces of metal are spread too far apart in some areas. I personally like to use a sunscreen primer or a tinted sunscreen with a mineral powder on top, or I'll use a mineral liquid foundation with sunscreen in it. Beyond sunscreen, the next thing I like to tell my patients about is retinol or retinoids. These compounds have been studied since 1940, and they were initially studied for their role in acne. The basic problem in acne is that the skin doesn't turn over and the pores get plugged. Retinoic acid helps your skin behave more normally and turn over better. Retinoic acid is available in variable strengths, And there are over-the-counter formulations, medical-grade formulations, and prescription-strength formulations. When you look at an over-the-counter product and it says it has retinol in it, you should know that this particular chemical has to be changed within your skin using your skin's own enzymes and turn it into usable retinoic acid. When you put retinol on your skin, you should know that it is going to take 3 to 6 months for your skin to respond to the product and for you to see changes. As a physician, I have the access to provide my patients with prescription strength retinoids, retinoids that can be used immediately upon delivery to the skin cells. Prescription strength retinoic acid does not have to be converted by your own enzymes to be usable. The way I approach my patients is that if they've never been on anything that is a retinoic acid or retinol, I will start with an over-the-counter retinol because it's easier to tolerate and the skin will get used to the ingredients. Once we know that the skin can tolerate the retinol, we'll often move to a prescription strength. These molecules basically block the UV rays from degrading collagen. It improves cell turnovers so that cells progress rapidly and nicely from the basement layer up to the top layer of the skin, and it allows the cells to slough off properly so that you can have glowing and healthy looking skin. Retinoic acid also thickens the epidermis, which is especially helpful in older skin, which tends to become thinner over time. It also improves pigment irregularities by decreasing the amount of melanin that is transferred to the skin cells from melanocytes. I also use prescription strength retinoic acid for my patients who have precancerous changes in their skin. This gives you an idea of how important I think retinoic acid products are for skin health. I think this is another one that everyone should be on. We also have some data on vitamin C and antioxidants. Antioxidants are chemicals that counter the effect of free radicals, and free radicals are molecules that are produced by many different processes, from our metabolism to UV light to radiation and other sources of inflammation, including air pollution. Free radicals are molecules that like to take electrons from DNA and other cells. They take energy, they denature proteins, so they're not the good guys. Antioxidants are very generous compounds that are found in fruits and vegetables. They're very giving. They allow your DNA and your skin cells to be protected by offering up their own electrons to free radicals. This makes them very unstable. They're very difficult to formulate, which is very tough for consumers to discern which formulations will be useful to their skin and which won't. The way you formulate vitamin C is important because it oxidizes very quickly and it can become inert and not useful to your skin. Some hints that I can give you in order to tell whether it's a good product or not is that it should be clear if it's in a serum. If the serum is yellow, it's possible that the vitamin C is oxidized. If it's sold to you in a clear container or clear tube, that's not good because light will cause the vitamin C to denature and become ineffective. So it should be in an opaque container. If it's mixed in with a lot of other things, it may not be very effective, especially if it's a very economical cream, because a lot of the processes to make it stable are costly. Vitamin C and antioxidants also induce collagen production. It's one of the few things that studies have shown to increase collagen in your skin. It also improves pigmentation because it affects the enzyme that is normally involved in hyperpigmentation or brown spots that we can get. So that's why using vitamin C is helpful for sunspots, as is retinoic acid. The fourth thing that I like to see in people's skincare regime are growth factors and peptides. This is more important for people who are starting to lose fibroblasts in their skin, so this tends to be something that someone in their late 30s should start focusing on. If you're very young and you have a lot of fibroblasts in your skin, you don't need to slather more growth factors and peptides on your skin. As we age, the quantity of fibroblasts decline, so adding growth factors and peptides may be helpful to you. These factors are naturally found in the skin, and they're important as they send signals to your fibroblasts to make more collagen and help your basal cells turn over faster. They are basically cell signaling compounds. So these are the 4 ingredients that I feel you need to focus on when you're looking at your skincare. Every year there seem to be newer, better, later, greatest things that come onto the market. Many of these things may not have a lot of data behind them. But the 4 things that we discussed today have been studied for some time, and I believe will make a great impact on the overall health of your skin. When you look at your skincare regime, make sure that you've ticked off the 4 items we've discussed. Start at the beginning of the list in terms of your budget. In other words, start with investing in a really good sunscreen. Then, if your budget allows, add in a retinol or a retinoid. If you can then add in a good antioxidant vitamin C serum and growth factors, that would be great. So that's my basic approach to skincare, and I thank you for listening. We welcome you to come into the clinic to discuss your skincare regime and how we can help guide you with these recommendations. I'm Harpreet Lotay with SONA MD in Kamloops, BC. Thank you.